Hey everybody, it's Devin.
And Kate.
And this is Med Crimes.
Sorry, we interrupted each other.
Come on.
I'm sorry. Happy February, finally.
Oh, didn't I just say last time, like, I hate January?
Yes, and it's finally over.
It's a good month. It's the month of love.
It is. Happy Valentine's, everybody.
Happy soon to be Valentine's Day.
Yes.
But more importantly, before that, it's my birthday. Hello.
Oh, happy birthday, Devin.
If anybody out there has a birthday the same week as Valentine's Day, I want to know your experience. Do you always feel like you get gypped that week?
So my niece's birthday is Valentine's Day.
Oh gosh, her future boyfriend to her future boyfriend.
Lots of pressure.
Do not
girlfriend.
Do not skip over the birthday.
Oh, I know it. It's gonna be
rule number 1, dudes.
I know it. Poor little girl. I feel for her, but she's the
my
cutest little
husband well.
Valentine, though.
I've told my husband, I'm like, birthday first, Valentine's Day second. No, thank you.
I completely agree.
Yep. Anywho, here we are.
Absolutely.
Work night.
We're here for you.
And okay, everyone, I apologize. I am a fidgeter. And it's come to my attention when I called Kate last week. I said, why am I so quiet?
I was going to be polite and not say anything.
I legit thought I was losing my hearing, but then I'm like, well, Kate's coming through fine, so I'm not deaf, so that's not it. But,
yeah.
Okay, so I've been restrained to my chair.
Mm-hmm.
I've promised I will not move.
Mm-hmm.
I will speak into the mic,
Good
and
job.
I will be a good little girl.
So far, things are sounding good.
So I apologize if all of a sudden, like, you're listening in your cars or whatever and you turn up the stereo to, like, what the heck did she just say? What the heck did the little mouse in the background just have to say?
Yeah.
Well, whatever I had to say, I mean, it was probably good. Awesome.
Obviously.
But you couldn't hear it.
I know. You're doing really well. She's being purposeful.
I legit, like, all I ever want to do when Kate is telling me this story is, like, I want to, like, sit back, relax, have my drink, and just be like, oh my gosh, Kate, what?
You can do that, but you have to, in your mind, be like, oh, I'm saying something now. I can't yell it in the
I've been giving
direction.
a techno lecture this week, and now I feel like I'm going to pass the test. I am a studious student.
Yes, ma'am.
And here I am, and here we go.
I really want to thank one of our Patreons, and I'm not going to say her name because she didn't explicitly give me, permission to say her name on the air.
We love you.
She was like, she messaged us on one of our platforms and was like, hey, so are we ever going to hear about Christopher Duntsch? And I was like, I don't know who that is.
I was like, who? Who?
I Googled him and was like, how the hell did I not know about this ass clown? I don't know. Holy shit, this guy.
Thank you, Patreon, for the suggestion, because Kate is now flabbergasted.
Yes. So, and also, if you're a Patreon, you get to, like, shout us out, and we're going to listen to you. If this is what you want to hear, you got it, baby.
You got it, dude. Kate's going to rock this one out again for us, and coming soon is finally another podcast by yours truly.
Oh, I can't wait for a Devon-centric episode.
Devon-centric. I know you've all been dying to hear me.
I mean, that's pretty much why everyone is on board here.
Yeah.
That's why you're all here, is to hear Devon, and they're always disappointed when they tune in and hear my dumbass voice.
And then here I am, hanging out in the bathroom, slouching in the chair, like, where did she go? We want her back.
So this is going to be a two-parter. There's a lot to get through here. Some of this stuff is kind of graphic. We're actually going to be talking about, like, the surgical procedures and what, a normal surgical procedure is supposed to be like. And
okay.
So we're going to get into some of the anatomy. It's going to be really interesting.
I love anatomy.
I know. If that's not your bag, though, trigger warning for that, just so you know. There's going to be a little bit of gore and a little bit of guts here.
Duntsch. So is that sounds Swedish. Is this Swedish or no?
Either that or it feels like either like Finnish, German, Swedish, one of those,
like over there.
Yeah,
that's what it
general
sounds like
vicinity. Yeah, okay. Somebody please let us know, because I did not look up the origin of his name.
I'm just
sorry.
listening to it, and
there was a lot of other research.
It sounds Dutch.
It does. Well, because it's Duntsch, which sounds like Dutch. Oh no.
I missed
Oh,
you.
I know, I missed you too.
Okay.
We're never apart for long anymore, but I always miss you when you're gone.
Christopher Duntsch.
We also have minions upstairs that are playing, so if the jackhammer is bothersome to you, we're very sorry, but they are running around stomping.
In case you start to notice, we're starting to say a lot that the little tiny feet are upstairs pounding around, and it's just because we're loving to do this. But we can't be away from our families.
No,
so
dude.
we're getting
Our
them
kids
together.
just,
The dads get dad time, the kids get kid time, and we get mommy time.
Yes, we love it. It's great.
Love it.
So, Dr. Christopher Duntsch, if you're not familiar, is an American neurosurgeon who earned the name Dr. Death for acts of gross negligence and malpractice, which resulted in the maiming of several patients' spines and 2 deaths while working at hospitals in the Dallas-Fort Worth Metroplex.
So 2 deaths, but
Yes.
other people survived, but obviously had
remained.
their spine, like they're completely paralyzed.
Were a lot of different degrees of paralyzed, gravely injured, and debilitated for a long period of time.
Okay.
It's really, really crazy. And actually, overall, out of 38 spine procedures, he was accused of injuring or killing 33 out of those 38.
What?
Isn't that insane?
That's not a good percentage at all.
So it makes you ask, like, immediately, why the hell was he allowed to get to number 38,
I was
right?
just going to say, like, why not? If he's 5 out of
If
5,
these outcomes
like...
are that bad, dude, we are going to pour over exactly, like, the details of how he got to this point. And it's just, I mean, it's a multi-level failure, for sure.
What time frame are we talking? Like, for...
Not very long. Like,
No, I
2
mean,
years.
like, how long ago?
How long ago? This was fairly recent.
Ugh.
This was very recent. We'll talk about it. So he was actually he was born, Christopher Duntsch was born April 3rd of 1971 in Montana.
So then he's only 50.
Yeah,
like 50.
exactly. Yeah, and he's been in jail. Yeah. So, shortly after his birth, his family relocated to an affluent neighborhood in Memphis, Tennessee, and where they relocated, the median household income there was like $30,000 higher than the national average. So this was like a pretty
so it's a
rich,
well-good area.
Very
good. That's good English.
well good. Nice. That was very well good of you, Devin.
Freaking right it was. Well good.
It was well good. So his family had money. Now his dad, Donald, was a physical therapist as well as a Christian missionary. The family was very devout, church every Sunday. They talk about Jesus Christ. They live it. They cite the Bible in everyday sentences. They're that type of people. Mm-hmm. And the mom, Susan, was a school teacher. And he has 2 brothers, Nathan and Matt, and a sister named Liz. So he had, by all accounts, a very comfortable upbringing. I mean, this kid never really wanted for anything.
Right. Lived in a good area, had a good family.
Exactly.
Christian values.
Parents were super stable. They both had stable jobs. You know, they didn't move around a whole lot. And, I mean, all of those kids
So what happened to him?
Well, through childhood, he attended Christian schools, including Evangelical Christian School in the Cordova suburb of Memphis, which is where he attended high school. And he started playing football for the first time in high school.
Touchdown!
And he excelled. He did amazing. In high school football, he was like a god. He did amazing. And he loved being the best at something.
Right.
Right.
Lots of attention that way.
We're going to see that this is a running theme. We're going to see that he kind of just did whatever he could do to make sure that he was at the top of the food chain in some way. And football was the beginning of this.
Right.
So he did great, and he went to college. He starts out at Millsaps College, and he played Division III football there, right?
Oh.
Which is it's not super competitive. It's a smaller college. It's a smaller pool of
but
people.
it's college ball.
No, of course. And so he did pretty well there, and he wanted more. So after the first couple years at Millsap, he was like, nah, I want to go to a better division school. I want to make a career out of this football thing because I'm doing really, really well here, which is reasonable. So he decides to transfer to Colorado State University, which is a Division I school.
Nice.
And they have a very well-known football team there.
As most Division I's do.
Exactly. And their peeps get drafted left and right, and they're very much on the NFL's radar. So he wanted to go there essentially to improve his chances of being drafted. Now, he Now, his classmates and teammates said that Duntsch put in a ton of time and effort into training, and he genuinely tried so hard to get better. I mean, he would like go to practice, and then, you know, he would do something wrong and not do as well as his teammates at something, at a drill or something, and he would spend hours in the field after everybody else went home running it and running
That's
it
great.
and running
That's
it.
Focus. That's
he was
dedication.
so motivated. And it was very frustrating for him that he was not doing as well here as he was in the Division III school and in high school
I mean,
ball.
there's a pretty big athletic
This was
difference.
a whole other league,
Yeah.
obviously. So he was not the shining star in this environment, and that really bothered him. And
Small fish in a big pond.
small fish in a big pond. You know, he had a lot of classmates and teammates and friends that it seemed like they were naturals and they were doing great, and they didn't even have to work as hard as he did. And he worked twice as hard. He practiced twice as often, and he just wasn't good enough, you know? So
He ain't no Tom Brady.
bye-bye, Tom Brady. Thank you for the wonderful, great years in New England.
Years.
Cheers.
I have been fortunate enough to see a lot of live Tom Brady games, so this retirement is big for me.
Yeah.
I'll miss you, Tommy.
Bye-bye, Tom.
Maybe he's listening to this because he's retired now and has a lot of time on his hands.
Yeah, he's definitely listening to this exact podcast.
Yeah, while he's drinking his coffee standing across from Giselle.
Why not? Medical true crime is totally his bag. So he spends 2 years, right, at this Division I school, really trying and struggling to match everybody else's
So
talent.
he's got to be like, what, a junior now?
Yeah, and so he just, you know, could not emerge from where he had faded into the background, unfortunately. So he wasn't, after 2 years, he wasn't starting any games. He wasn't even playing a whole lot anymore. And it became clear that, like, I'm not going to get drafted. Like, I'm just not. I'm not going to get drafted if I'm at a Division I school and I'm on the bench. I'm not going to get seen.
You need the TV time.
Exactly. So this was sort of a turning point for him. He's like changing his whole game because remember, you know, from here on, you know, it was football. He wanted to be a football star. That's what he wanted. And now he's like, I got to like really rethink my shit here. This is the point at which he transfers to Memphis State University, and this is closer to home for him, right? And this is where he completed his undergraduate degree in 1995. In order to complete a pre-med degree for him, it really only required like 2 more semesters of work. So that worked out. And this is when he's like, you know, I can't be at the top of the food chain in football. So what's the next best thing? Be a physician.
Okay.
Right? That's, well, I mean, that's like what you do if you want to be at the top and know you're going to make a lot of money and have a great job.
Right.
You know, that's one of the big careers that people go for.
Doctors, lawyers.
Doctors, lawyers. Exactly.
Yeah.
So that was his... That was his logic anyway, is what I'm saying. I'm not saying I necessarily agree with all that, but that in his head, the next best thing was to be a physician because that was another being at the top.
Right.
Another way to be at the top. Now, he had put all of his eggs into this football basket, right? And he didn't want to just be a doctor. He enrolled in the most rigorous program that was there. And it was
in Memphis.
And he enrolled in the MD PhD program, which is a dual degree track.
Yeah, I was going to say, because that's like a,
Exactly. So there, he would go on to earn not only his MD and be able to sit for the boards for the MD, but he would earn a PhD in microbiology.
Okay.
So lots of work, incredible amount of work. Again, here's this pattern emerging of wanting to be at the best and highest level at everything. So
so far he's doing a pretty good job.
He is, and he busts his ass. He busts his ass hard, and he starts into this MD PhD program. He took the MCATs, Devin, and he literally only got a few wrong, which is like
unheard
of. It's incredible. This kid studied his ass off, and he like is killing it.
I'm anxious for the part when I start to again not like him.
Well, you'll get there. Don't worry.
All right.
He starts studying right in this MD PhD program, and he's so adept with the science, and he's so great at the science, and he's got such a scientific mind that he really is excelling in this. And all of the whole scientific piece for him comes very naturally. And he actually kind of starts focusing more of his energy onto the PhD piece and less as much.
Yeah.
Exactly. Because it just comes so naturally. And he participated in a lot of like research, and he was published many, many times. And his name is included on a bunch of patents. And while he was in medical school and in residency, he started really researching stem cells. And stem cells was
I love the thought of stem cells.
It's a huge fascination to him.
That's always something that's fascinated me.
Exactly. And stem cells are found in a few different areas in the body. They're kind of rare actually to find in grown adults, but they are abundant in fetal tissue.
Cord blood.
Yeah. And so one of the big things that really got him during his residency in particular was, stem cells take on the properties of the cells around them, and they have regenerative properties because of that. Now, while he was doing his residency in spine surgery, he wanted to go into neurosurgery, but spine is the more lucrative route because you make a lot of money doing spine surgeries.
Well, because if you F it up.
Yep. So, and plus there's everybody has back problems. My fucking back hurts right now. So he was really, really into this stem cell research, and he started thinking about different ways you could use stem cells. And he said, why can't you harvest some stem cells and inject them into a degenerated disc, vertebral disc? Thought. And he
regenerate it.
I mean, it's not as simple as how I'm saying it. There's a lot
of
science
clearly
behind it. There's a lot
but
of
I love
science
the
behind
idea.
It. And he worked really hard.
This guy would have taken stem cells and cured like COVID, cancer.
I'm literally telling you, this
he decided
guy
to kill people instead.
Now, he's got a friend that he went to school with, went back in high school, and they actually played high school football together. His name is Jerry Summers. And
sounds like a very football name.
He's like a down home, like country boy, and they just really got along. And you know what about Jerry is that he thought the world of Chris.
Oh, and just like I think the world of you. I'm the down home country girl.
This was a little extreme, though. It was sort of like Chris could do no wrong. And he really looked up to him in many ways, from football to like whatever. No, I don't think he was in love with him.
Okay.
But he really looked up to him. And I think Chris really liked being around someone who like literally worshipped the ground that he walked on.
Well, again, part of being top dog.
It's part of that. Exactly. Yeah. It's all part of that dynamic. Yeah. So they spent a lot of time together, and actually, while he was in medical school and residency, the two ended up being roommates. They moved in together. They got an apartment. So by the time he graduated, he was $500,000 in debt from school, and he decided that he wanted to go into
typical? 500,000.
Yeah,
for an MD.
Yes, MD PhD program. Probably. I think probably.
Okay,
absolutely.
Wow.
So
kudos to you
I know,
guys.
isn't that insane?
Kudos
right?
to you guys.
You guys go. You get it, dude. Anybody who's done this. Woo. So he's in all this debt, and that's part of what makes him decide to go into neurosurgery and more specific spine surgery, because again, that is the most one of the most lucrative specialties that there is.
It's very elite.
Yes, very elite and very lucrative.
Yeah.
Now, when he was in residency, I mentioned that he was really into stem cells. And, he works tirelessly during residency, mind you. During residency, he's working tirelessly on this research project and this idea of disc regeneration using stem cells.
It's amazing.
He busts his ass. He finds himself investors. He puts together a presentation, and he founded this company called Discgenics. Which literally...
that's cool.
Isn't that cool?
Yeah.
And his name is, if you Google Discgenics, his name is all over that. It's a whole patent around disc regeneration using stem cells. Now...
How do you have time for this shit?
How the hell did he have any time for this? So, while he was in residency, residency is designed to be
gruesome,
an immersive experience, right? Residency is so immersive, and it should be, because it's designed to train people to be functional physicians. You literally eat, sleep, breathe medicine.
Yeah.
Now, there's really no room for anything that Chris was doing here.
Right.
So there was a physician there that was one of his supervisors during his residency program. His name was Dr. Foley. Actually, I believe it was Kevin Foley. I think it was Kevin Foley. And he really took a liking to Duntsch because the kid was so bright, and every question he asked, he could answer. He could rattle off an answer, no problem. Now he was
pupil.
Exactly. So he was kind of that star pupil, and even into his residency, he got really interested in the work that Chris was doing for his PhD and for this company Discgenics. Now, it's said that he would actually let Chris out of a lot of the residency obligations that he was supposed to adhere to in order to focus more on this.
Teacher's pet.
And if you look at who else is on the board for Discgenics,
it's that guy.
It's that guy. And he was financially invested in this company as well.
So that's all well and good, but
if
you skip the basics, right to go to the fancy stuff.
Exactly. So this guy has experienced a lot of scrutiny for his role in this, because while it can't really be proven there's not a whole lot of records kept here, it did kind of come out that Chris only participated during his 7-year residency in about 100 to 200 surgeries. Now, the average number that a spine surgery resident experiences.
I mean, so 7 years is, I mean, like how many days, right? Like thousands.
And I mean, you're working weeks at a time nonstop.
Yeah.
So
1 to 200 is not a lot.
The average neurosurgery spine resident participates in well over 1,000 surgeries during a course of the program.
Hello. So barely 10%.
Literally barely 10%
of what his peers were doing.
So it wasn't just like a few days of leaving early. This guy just like literally skipped
got out of most of the residency.
80% of his residency. Yeah. So
holy hell.
This, I think, is like the root of the reason why he was so insanely unprepared for this. Now, this guy, Kevin Foley, had this fellowship program that specialized in spine, and it was very competitive. A lot of people wanted it. And of course, he and Chris Duntsch were so close during residency that he offered the spot to Chris Duntsch. So he got this fellowship where this whole thing continued. He was let out of his obligations because he was putting so much energy into Discgenics and into this company. And this guy was enabling that because he was financially vested in the company.
This is the whole can't run before you walk.
Exactly. So he finally does complete his residency and subsequently his neurosurgery spine fellowship. If I was his
peers, I would have been, part of that program with him.
I don't think they really knew somehow. Okay, so finally, after some hiccups and missing a whole lot of his work, he completes his residency and his fellowship in spine surgery at Semmes Murphy Clinic in Memphis.
Scary.
Yeah. So during his 4th year of his residency, though, he was suspected by some staff members of being under the influence of drugs while at work. Now, he was participating in a surgical procedure on a patient, and he just seemed, out of it, zonked or whatnot. So at that point, an issue was raised, and was
he falling asleep with a 10-blade?
I'm not sure what he was doing.
Okay.
It just said that he appeared that he was under the influence. So he was issued a drug test. He tested positive for cocaine. And subsequently, he was transferred to a program for impaired physicians. And here is where it's a program specially for residents or working physicians that have substance abuse problems, and it gets them back on track without derailing their careers completely.
But here we are, 4 years into a 7-year program. Yeah. You now have a drug problem, and you're getting maybe 20% of the work in that your peers are.
I think a lot of this came from him needing literally to not sleep and to have the energy to do everything that he was taking on.
Right.
And so he remained in this treatment program for several months under treatment, and then he was permitted to return to his residency program. So there again is like another little hole in, his education. A lot of his colleagues and his co-workers recall that he would like go out to party and have long nights of drinking and doing drugs only to present for work again in the morning on literally no sleep.
That's not really a quality I'd like in my physician.
No, I don't want this.
Specifically my neurosurgeon.
Yeah, for real, right?
No, thank you.
So a colleague actually was quoted as saying, quote, "I would never let that guy operate on me."
Thank you.
Quote. Yes,
he agrees with me.
Now, because of his behavior getting a little bit more erratic and he was not reliable, he was eventually asked to leave Discgenics, that company that he founded, due to substance abuse issues. And they did offer to let him remain on the board. So to this day, I believe he's a board member.
Okay, but he's not actively involved.
Not actively involved in the company. The year is 2010, and he decides to settle in Dallas, Texas. Now, while in Memphis, back in 2011, completing his residency, Christopher meets this lady named Wendy Young. And the two met actually at a bar where she was working. She was a student at a neighboring community college. She was 27 years old, and at this time, he's almost 40.
I was gonna just do the math. Wow. Yeah. Okay.
So the pair
this is not
began
that
dating.
long ago. This is 12 years ago.
Yeah, I'm telling you, this is all very modern case that we're looking at. So the two hit it off right away. She's like a super beautiful lady. Like, she is stunning, gorgeous. And
marrying a doctor.
Yeah. So the two like meet, and Wendy recalls being smitten and was kind of enchanted by the idea of being like in this relationship with this guy who's a surgical resident, and he's going to go into spine and like make all this money. And this guy's just such a great talker that she was just like, I'm sold. Like, you don't have to work that hard. So the two hit it off, and after a couple weeks, he actually convinces her to move to Dallas with him, where he's going to resettle once he finishes his residency program in Memphis. And she actually took that bait easily because she grew up in the Dallas area. So she's like, yeah, this sounds great. Remember Jerry? These two are still super, super close.
Okay.
Right? So
they're lifers.
Yeah. So he actually convinces Jerry to go along with him. Jerry's like, I worship you, man. Like, where you go, I will follow. We're besties
where
to the end.
Where you lead, I will follow. I feel like every podcast needs a musical interlude by Devin.
I completely agree, actually. So I think Chris really enjoyed having that person again that was just like feeding his ego, you know? So Jerry comes along. Now it's like a 3-wheel party there down in Dallas. I know. So the two dated for a younger number of years, and they had 2 kids together. And after Wendy graduated from college, you know, her goal her whole life, she's like, I just want to stay home and be a mom. That's, you know, I don't really care about a career. I do want to stay home and be a mom. So that's what she really wanted to do. Now, in Texas, he starts looking for work. And he, on paper, is looking extremely qualified. You know, he's got this PhD. He was in this really prestigious fellowship program that was super competitive. He got really high remarks from this guy, Dr. Foley.
Co-founder of Discgenics.
Yes, exactly. So, I mean, everyone's wanting to snap him up. So he spent this total of 15 years in training, right? His curriculum vitae, his resume was 12 pages long.
Jeez.
12 pages. So he had definitely beefed things up a little bit, I think.
Just a little, just a little fudge.
He actually had made some claims in that resume that he had graduated magna cum laude from St. Jude's Children's Research Hospital with a doctorate in microbiology. And at the time, that hospital didn't offer that program.
Anybody notice that?
You're
Anybody
full
pick
of
that
shit,
up?
Christopher.
You're full of shit.
Yes. So down there, he's like, you know what I'm going to do is I'm going to start my own clinic, like an outpatient clinic, and then I'm going to get surgical privileges at neighboring hospitals so I can do my actual surgeries at the hospitals there, which a lot of surgeons do. They have the clinic at a separate location. So now Baylor Plano is this really big hospital, and they worked really hard to recruit him. Finally, he joins up with Baylor Plano. Now, this is Baylor Regional Medical Center at Plano, Texas. So it goes by Baylor Plano is what it's referred to as. And they recruited him really hard. They're like, please we want you to get your privileges here.
Here's your millions.
Here's your millions. And, you know, they really needed a good neurosurgeon because neurosurgeons bring in $2.5 million a year at hospitals for revenue. Yeah. So they were recruiting him really, really hard. So he signs on as a minimally invasive spine surgeon with a projected salary of $600,000 a year. So he's on cloud 9. This is great, right?
Yep.
Now, if you guys aren't familiar with how the privilege thing works, now a given physician, their credentials are reviewed by a board that sits at a given hospital if they're going for credentials. And This board goes over what their training was and what their capacity is, and they say, okay, we're going to grant you privileges at this hospital to do this, this, and this. Now, for example, if, a neurosurgeon came in and said, well, I want to do an appendectomy on a patient, they would say, you can't do that because you do not have the surgeon privileges to do that.
To do appies.
You are not privileged to do that.
Thank God you didn't work when I had mine.
Right? Yeah, exactly. So, and you can get privileges at multiple hospitals. They grant him privileges there. And he's starting his outpatient clinic. And he starts looking for staff there. And he interviews a woman named Kim Morgan, who I found some sources that said she was a PA, but a lot more sources saying she was a nurse practitioner. And she actually had her doctorate. So that makes more sense that she was a nurse practitioner.
Right.
And she had a lot of experience in neurosurgery. She had previously worked at a neurosurgery clinic. And so her role would be to run the day-to-day at the clinic. Like if he was in the OR, she could see patients and do the pre-op stuff. And, and then
do the consults.
She would assist in some procedures. Mm-hmm. So the two hit that off. She also is a looker. I'm just letting you know. So he's starting his outpatient clinic, and he starts doing his first few procedures at Baylor Plano. And he makes a really shitty first impression. Now, he was the new guy, right? He was fresh out of fellowship, and yet he was boastful. He was cocky about his abilities, and he, everybody he ran into, he just rubbed them the wrong fucking way.
That's because nobody likes a cocky asshole.
No. And so they started really advertising that they had this service at Baylor, and there were these ads in the paper advertising this minimally invasive procedure that was real state-of-the-art, and patients, would wake up from anesthesia wearing only a Band-Aid, and they were up and walking within the hour, and how progressive all of this stuff was. And they got a lot of attention, and websites started advertising him as having this 5-star rating. And
who rated him that?
Well,
did they make it up?
I think a lot of it was made up. And actually, Jerry Summers, his buddy, started doing a lot of advertisement work.
Did he make his own Google reviews?
Probably. Probably. And his buddy Jerry did a lot of that advert work for him when he was starting out to help him make a name for himself. Now, pretty quickly, his patient roster and surgical schedule started filling up, really quickly. Now, he's got this colleague at Baylor Plano, a veteran vascular surgeon by the name of Dr. Randall Kirby. And in subsequent interviews, Dr. Kirby recalled that despite his boastful attitude, watching him in surgery was very alarming and left a lot to be desired.
Did he just futz around, bump into things, when you feel really...
So he said that, quote, he couldn't even properly hold a scalpel.
That's fucked up.
He didn't know a lot of the instruments, really basic entry-level stuff. He didn't even know any of that. So,
guess you shouldn't have missed out on the other 80% of your residency.
Yeah. So now, around this time, things with he and Wendy get a little stressful. And he actually starts having an affair with that nurse practitioner that is working for him, Kim Morgan. Who's good. We like Kim.
We like Kim.
Now, right away.
Do we feel bad for Wendy?
No, we feel bad for Wendy too, yeah. So, right away, many of Duntsch's procedures begin to go horribly wrong.
Well, if you don't even know how to hold a scalpel.
I mean, it was really bad. And so, we're going to talk about some of the events at Baylor Plano. So, case number 1, Kenneth Fennell was Dr. Duntsch's first ever patient that he operated on at Baylor Plano.
Very first ever.
Very first.
So the guy that they witnessed him holding the scalpel the wrong way. And
So Kenneth suffered from a disc protrusion. Now, in normal anatomy, in a normally functioning back, you've got vertebrae, these, spine bones that go, you've got a whole bunch in the neck, a whole bunch in the thoracic, and the whole bunch in the lumbar. And between all of those,
the lumbar region is why Kate hurts today. It's the region that
L5S1.
L5S1.
Oh, that's the most common spot to have a disc herniation or protrusion. Now, we have these little bits of soft tissue called discs between all of our vertebrae. And a really common problem and a common cause of chronic back pain is erosion or degeneration of the disc, in which it becomes sort of, hard and doesn't really provide the cushion that it's supposed to provide, or the disc can actually poke out from between the vertebrae or do what's called herniate, and that can either push on the spinal cord or other structures and create a lot of discomfort.
I'm loving this talk.
You're
loving
welcome.
it.
You're welcome. So, now normally fixing this is something that a neurosurgeon would just have in there. I mean, this is the most run-of-the-mill, easy, everyday procedure. This is an appy. Yeah, exactly.
Right?
This is incredibly straightforward.
Okay.
There's really no reason for any of this to have gone wrong. So this guy, Kenneth Fennell, was seen in the clinic and subsequently underwent what was supposed to be a discectomy of this protrusion.
Can you say that again?
Discectomy.
I love that word.
You're welcome. And so what they do is they cut down and they find the problem vertebra, and they can gently tease it out with a scalpel, or sometimes they'll curette it out gently with a blunt instrument. Mm-hmm. And Duntsch operated on the wrong level of the spine. The wrong level entirely. So he did not touch the problem disc. And he was left in debilitating pain. He woke up and he was worse. 10
say
times
it was
worse.
in the thoracic area and he pulled one out from the lumbar.
Not necessarily the entire different,
right,
but instead of L5S1, it was he operated L1, on a completely different level.
Oh my gosh.
So he wakes up in worse pain. Duntsch tries to convince him, listen, this is normal.
Do they not have to circle on your spine? You know how
they can't really do that on the spine. They can do that for laterality.
Well, yes, they do, but they don't.
But not on the spine. They can't really do that. Now, a good surgeon. Now, I've been in a spine room, in an operating room, and what they do is they look at the images and they point to the vertebrae and they say, this is where we're going. They pull up the MRI and they say, there's the disc. It's right here, and that's where we're going. They have it on the screen as they're cutting the person
in the
open.
body.
And that's how it should be. And obviously that did not happen here. Now, Fennell went under the knife weeks later to try to repair this damage because he was in so much debilitating pain. Again, with Duntsch. And this time, Kenneth was left... Yes, and this time, Kenneth was left paralyzed initially. It took months of rehab for him to regain any ability to stand. And to this day, he can only walk about 30 feet and stand for a few minutes at a time.
Gosh, that sucks.
So, that is poor Kenneth Fennell. Now, we have Lee Passmore. And this is another patient who required the placement of some hardware along his spine and also a fusion procedure. Now, sometimes if there's some degenerative disc disease or some compression fracture and some degeneration of the vertebra themselves, they can actually cement some vertebra together to if they have compression fractures or something, to sort of stabilize that. And they can put hardware around it, to further stabilize that part of the spine. Another pretty darn straightforward procedure for someone who's been trained as extensively as this guy. So this guy happened to be a Collin County medical investigator, just so you know.
Okay. Oh, bad guy to F it up on.
Yeah, but weirdly enough, I didn't really see that anything came out of that piece.
Oh, bummer.
I think it was just written off in the beginning.
You
as
don't fuck up a surgery on a medical investigator.
And Duntsch fucked this guy up real bad.
Oh, great.
So this guy, he cut a ligament that was not normally cut during this procedure. Completely severed the ligament. And then he installed hardware, plates and screws at the wrong level of the spine. The screws, so they couldn't be removed. He stripped the screws. He made cuts and dissections dangerously close to major blood vessels.
Oh.
A colleague of his by the name of Mark Hoyle, who was a vascular surgeon assisting on the case, he recalls being stricken by this guy's complete lack of attention and obliviousness to what he regarded as very considerable bleeding. Now, surgical peeps, when you're performing surgery, or your surgeon is performing surgery, you're suctioning the field of capillary bleeding to keep the field visible, right?
Yeah.
If the field is full of blood, you can't see what's going on. Sure. So you suction it so that you can see the structures.
Suction.
Duntsch did not do this.
What?
And he physically told people, I work by feel.
Stop it.
He literally said that. I don't work by sight, I work by feel. He was putting instruments into a pool of blood in this guy's back, and the actual surgical field was completely invisible. That's a huge no-no. And Hoyle was watching this all unfold, and he was so disturbed by how this case was going that he put his hands on Duntsch and physically restrained him.
Good.
And he said, you need to stop what you're doing.
And who was this Hoyle guy again?
So he was a vascular surgeon that worked there that was assisting on the case.
Okay, because I was about to ask you, like, isn't there usually, like, an assistant, a second surgeon, whatever? And
sometimes in certain procedures,
because I was thinking for the first guy.
The first guy... And we're going to talk a little bit about that, too, why he was allowed to perform as many surgeries, right?
Did nobody think with the first guy, like, how the heck did you not get the right disc?
Yeah, we'll talk about that next. So, he physically restrained this guy, telling him to stop what he was doing. And the case kind of, blows over. After the case stops, he pulls Duntsch aside and he told him to his face that was dangerous. And he was questioning Duntsch's sanity based on his behavior in the OR.
Absolutely.
And you asked, why is nobody doing more to intervene on this guy? And obviously there was clear patient harm here.
Clearly.
And thankfully, Dr. Hoyle grew some balls and he put his hands on this guy and was like, get the fuck away from this patient. Stop what you're doing. You're dangerous.
Because whether you're in someone's spine or if you're in someone's abdomen, like this is surgery 101 and he's going against all of that.
His attitude was very cocky. He was a very good talker and he explained away a lot of his behavior and said, I'm doing it right. I'm doing it fine. And if anybody in the room questioned him during his procedure, he would just essentially write them off and say, fuck you. And again, the politics in the OR,
right?
People are afraid to,
right?
As a scrub tech, I don't know that I would, have the balls to. I want to say, hey, you're doing this fucking wrong.
When you talk about politics in the OR, I had one day in the OR back in the day, and I'm pretty sure I've told you this story.
Yeah, I love
this.
And
it goes along the lines of the ballsiness, right? So there was a physician's assistant in the OR. And he sees this little old nursing student coming in, and so he just goes, oh, so you're in nursing school, and what are you doing? And trying to talk to me and engage me in the surgery. And he goes, I need to ask you a question. I want to test your knowledge. And we were, so he goes, what is the percentage, what is the ratio of men to women with prostate cancer?
Like, let me think about this.
Well, considering that women don't have prostates, it's 1-0 or 100% men, no women. Like, however he wanted to play it. And he's like, I'm sorry, what? And of course, this was my first experience, talking with a mask on, because I'm in the OR. It's not 2020, in 2022, where it's like, we've learned to elevate our voices and accentuate what we say. This nurse behind me goes, she said women don't have prostates. Can we move on now?
A very certain personality that thrives in the OR, and I tried to work in the OR.
I remember you did.
And I could not complete the training program because it just was not for me. And the people that do it, oh God, you guys are incredible. Not for me.
Yeah.
Not for me. But what I learned there was amazing. Watching the procedures was amazing. These people are incredible, and they're so highly skilled and highly trained.
Surgeons
Every
are,
staff
and
member.
They're great.
And scrub techs, my God, a lot of these scrub techs could, in the third world, easily perform the procedures that they witness every day, multiple times a day. So, lots of love and respect to all you OR people.
Yes.
So, let's talk about another case. Moving on, because believe it or not, this guy was allowed to continue doing all this stuff. So, Kim, by the way, Kim Morgan, his nurse practitioner,
who he's doing on the side.
Yep. The nurse practitioner colleague was assisting on a few of these surgeries. And she noticed right away, having had a lot of experience in neurosurgery, that something is not right here. So let's talk about Barry Morgulov. Now, he is the owner of a pool company in Texas, and he was left with bone fragments in his spinal canal after his encounter with Duntsch. Apparently, Duntsch tried pulling a damaged disc out of his back with the wrong tool, causing severe damage to the remaining disc tissue. And during his recovery, he, of course, experienced intractable back pain. Duntsch initially labeled him a drug seeker and refused to give him any pain medication. Unfortunately, Barry's functional status declined. He ended up losing most of his function in his left lower extremity and eventually required a wheelchair. Now, Remember Dr. Randall Kirby, the vascular surgeon from earlier?
Mm-hmm.
Now, he was assisting on this procedure, and he recalled that he needed to point out anatomy to Duntsch during the procedure.
Stop.
Like basic, clear anatomical landmarks.
Stop.
Yes. Now, even after Kirby pointed out these and attempted to correct his techniques, he continued doing whatever it was he wanted and basically completely ignored his advice. And he recalled that later on, the two were in a conference together, and Kirby just had to stand up and walk out of the room because Duntsch was showing clear signs that he was inebriated or under the influence of something.
Oh my gosh.
Yeah.
Oh.
So, poor Mary.
I don't even know how that doctor could, like, be in the same room with
Isn't
him.
this insane?
Yeah.
I just can't wrap my head around this. And there's tons of these. So, let's talk about Jerry Summers. Does that name sound familiar?
Jerry Summers.
Jerry
His friend.
Summers.
Oh my
His friend
God.
had long-time neck issues.
Stop.
I shit you not.
Oh no.
Hold on.
What does he do?
So, the longtime friend of Duntsch's, because at this point he's been through several surgeries and things are not going so well.
No.
So,
He turns...
Jerry says, you know what? You need a win. And we've talked for years about you doing surgery on my neck when the time is right. And you know what?
God.
I know I need a fusion in my neck and I want you to do it.
Oh no.
So he comes to his clinic for his chronic neck pain. And it was determined that he needed 2 neck vertebrae fused. So the anesthesiologist who was present during the procedure...
I'm scared.
I know. The anesthesiologist that was present during the procedure recalled that Summers had an estimated blood loss in EBL of 1,200 milliliters. This is about a fifth of his entire blood volume and
Wow.
nearly 24 times the typical average EBL for this procedure.
Oh, because isn't that a very small incision? You're working with a
It
small
is. I mean, you're in the
field.
neck, right?
Yes.
But
So
this is a
1,200
tiny
cc's is a
field.
lot.
It should be way less than that. Yeah. Now, by the end of the procedure, Summers was rendered a quadriplegic. Yeah. Duntsch initially refused to perform any type of revision surgery, which may have helped him regain function. And initially, Summers claims that the two of them partied together the night before surgery, and they both did cocaine. Now,
You would think Jerry would be like, "Hey, Chris,
yeah.
can you not do that?"
So
Line of coke over there?
this did trigger like an investigation because he was very vocal about that during his recovery. And
Who, Jerry was?
Jerry, yeah. And so Duntsch was permitted to continue operating while he was under investigation, and he was limited to only minor surgeries, but he did pass a drug test. And Summers later admitted that he was lying because understandably he was really pissed at Duntsch for fucking him up and not helping him.
Oh my gosh.
So he remained a quadriplegic, and he passed away in 2021 from complications of being a quadriplegic. How incredibly
What a
sad.
shithead.
Yeah.
What a shithead.
Isn't that just, it chaps me. It's so
I mean,
sad.
I would hope that if he had any kind of soul, he would say to his best bud, like, "Hey, dude, like, I respect you,
my
but let
outcomes are
me
shit
refer
right
you
now."
to the best of the best,
Yes.
like, and all, you know."
You would think that he would have enough self-awareness. He's an intelligent
But
guy
he
to
thinks
say,
he's amazing, and he
my
thinks he's the
outcomes
best.
are not
so
great, so go to somebody else. I'm obviously not
I
ready.
can't do this
I
to you.
don't
If
wanna
something
hurt you.
happened to you.
Yes.
I mean, I would hope if I'm ever in
So-
the hospital, you'd be like, "Devin, you're on my assignment list today.
Yeah.
Do you want me to do that?" I mean, I'm more like, you know, like, have that.
Of course.
But no, this guy's like, "Hey, I got you back.
Yeah.
I'm the best of the best.
And that's the
Come
thing.
on to my
This
table."
common theme of, I can do it, I'm doing it right. And what he said repeatedly was, well, the scrub tech didn't know what they were doing, or the anesthesiologist fucked up and they lost a lot of blood and it was all the anesthesiologist's fault. I mean, it was everybody else's fault.
The
but his.
anesthesiologist didn't make him a quadriplegic.
Yeah, exactly. So,
The anesthesiologist is sitting in his head. He's not the one with his hands in your spine.
yes. So, this next one is sad. I mean, they're all sad, but this next one is a lot.
Jerry's really kills me.
I know. So, Kelly Martin was
Pretty
a
name.
54-year-old, otherwise healthy woman who suffered a herniated disc following a back injury, where she fell off of a ladder. And she underwent a surgical repair with Duntsch, and it went horribly wrong. During the surgery, she suffered major arterial injury and began to bleed profusely. Despite losing massive amounts of blood, Duntsch continued to operate. Anesthesiology and trauma surgery were involved in the case, Both of them urged Duntsch to abort the surgery due to blood loss and call in a vascular team, and he refused to do so and continued to operate. He completed the surgery and sewed her back up, and she was transferred to the PACU, where her condition continued to deteriorate. She had obvious bleeding and her vital signs were becoming unstable. Staff reached out to Duntsch, and he refused to acknowledge that anything was wrong and was turfing off the patient's instability to anesthesia.
Oh my gosh.
She became totally unstable, and this woman that underwent a simple procedure ended up in the ICU. Even then, Duntsch was in his office dictating notes instead of attending to his critically ill patient. And she woke up from anesthesia briefly, screaming and clawing at her legs. She was in so much pain that it forced the ICU team to resedate her. Oh. And ultimately she went into hemorrhagic shock, and despite the ICU team's best efforts, she coded and died.
Holy shit.
Yep.
Holy shit.
Isn't that just
mid-50s going in for a minor back procedure?
Yeah. So it was here that...
Please tell me the alarms are going...
Yes.
We got so much shit going on, especially if she's crashing and crashing and over, and he's just not responding.
Yeah.
Like, there's... Shit goes down here, right?
Yeah. So...
Good.
First of all, Kim, nurse practitioner...
Yeah?
...is like, we're breaking up and I don't want anything to do with you.
I mean...
She witnessed a lot of erratic behavior, and she knew Jerry too. The three, they were all friends. They hung out, And so she was like, I'm out. I don't want to work with you anymore. Goodbye. Finally, Baylor Plano makes the determination.
I would hope that she would have spoken up too before the whole Jerry surgery.
I would hope so too.
If she had been in the OR and then she knows that relationship.
Yes. So finally, Baylor Plano makes the determination that based on his track record, he is not meeting their standards of care. They revoked his privileges at the hospital.
Good.
And Duntsch resigned during his formal review rather than face termination.
Fine.
So,
whatever.
There was a bit of a legal battle here, because if he had been terminated, he would have been reported to what's called the National Practitioner Data Bank, which is intended to be like a database to flag physicians and providers that have offered suboptimal care or whom are problematic for some reason.
Kind of like reporting a nurse to
exactly
to the board.
Right. Exactly right. So ultimately, though, the legal team and Duntsch's lawyer came to a deal where he could resign, and because he resigned, they were not required to report him to the National Data Bank.
Not required, but couldn't they have?
Oh, sure, but they weren't required.
I'm really pissed that they didn't. They didn't, did they?
No. So from here, he moves on to Dallas Medical Center.
Because now at this Dallas Medical Center, he can say that he resigned for whatever reason.
That's exactly
political
what happened.
Differences, whatever else.
That's exactly what happened. So from here, he moves on to Dallas Medical Center in Farmers Branch, Texas. And they grant him temporary privileges while they await his reference letter from Baylor. And Baylor issues them a neutral reference letter that said, that was part of their agreement, was that he would get a clean reference letter.
I'm really angry about this, don't they? They
all
know
are.
that he's not safe.
Yes.
They know that he's not making safe practices.
Yes. And they did
that's
very
not
little.
okay.
They did nothing to stop
because
him,
they know what's going to happen
they said,
to the
go
next.
do your stuff somewhere else. Don't do it
and they
here.
know
Go
what's
do
going
it
to
somewhere
happen to
else.
the next slew of patients in the next OR.
Yep.
That's not okay with me.
Yep.
That's like if I was part of somebody resigning and I know that they have unsafe practices, but here, go work at this other place.
Yes.
You effed up all this shit. No, that's not okay.
So now that I've gotten you all riled up,
we're stopping.
We are stopping. Devin is fucking heated. Her cheeks are all red. Her hair's a mess. Guys, there's so much more. This gets really crazy.
Oh, crap.
The whole legal piece and the investigation is really fascinating.
I'm really pissed at hospital administrators.
Can't you? It boggles my mind. And we're going to we'll go a lot further into the whole issue with Baylor not doing anything to stop him from practicing and not doing anything to stop him from doing this to other people.
We have obligations as healthcare workers.
Yes, we do.
No matter where you are in the healthcare field.
Yep.
We're all like mandated reporters.
Exactly.
Don't let this guy do this
Let's not do this to each other, man.
Or at least get him red flags so if somebody else is like, you know what I mean?
Exactly.
If you can't stop him from working somewhere else, you can red flag him so that someone else can ask the questions before they give him a knife.
Yes. So,
Here we are.
Thank you so much for listening, you guys.
I could tell it was getting time to end. You know why?
Why?
I'm shivering.
I'm shivering too. Actually, I was like, oh, I'm shaking. Damn. So, you guys can find us on Instagram at MedCrimes Podcast, or you can find us on Twitter at MedCrimes PC. You can search us on Facebook by searching MedCrimes Podcast. And
if you wish to become a Patreon, you can visit www.patreon.com/MedCrimesPodcast.
Do I have a monopoly on reading the?
I want to interject every once in a while.
I'm going to let you do it from now on.
I mean, you still look at the Q page to like make sure that you get it, but I don't feel like you need to.
Okay, no, you really don't. Not after hearing it so many times.
Twitter. Thank you for listening, guys.
Spot. Yes, thank you so much.
We have a lot more coming up. Kate and I kind of have an exciting day next week, and I can't wait.
Oh, hell yeah. And we can't wait to bring you the rest of Christopher Duntsch. It's fascinating. I highly, highly, highly recommend watching Peacock's Dr. Death. And it's based on
I really want to watch it, but I feel like I have to wait until...
I would wait.
Yeah, wait. I'm going to wait until after our episode.
Yes, I would wait if I were you. Now, I
don't want to spoil it.
I actually researched it before I watched, and I was like, this is going to be really heavily dramatized, but they didn't need to dramatize it. And it wasn't. They did such a great job with it, and it was so interesting. It's actually based on Wondery's podcast entitled Dr. Death, which is, it has a whole bunch of interviews with Dr. Kirby and Dr. Henderson and everybody who was involved in the case, and it's really fascinating. I highly, highly recommend it, and there's a lot of awesome information.
Watch it after you listen to our part 2.
Yeah, baby. Or before, whatever you want to do. You do you, babies. We love
I'm not
so
allowed
much.
to.
No, Devin's not allowed to do anything I don't want her to do. Till next time.
See ya.